Hey guys, I'm Carissa Delahook, and our CLC presentation is on microbial diseases of humans. I will be talking about bacterial wound infection. The most common bacteria associated with causing a wound in humans is Staphylococcus, which is often referred to as staph infection. These wounds often present as boils or a pocket of pus. Common symptoms are tenderness, swelling, and redness of the area. This is often a result of cross-contamination from bacteria, such as Staphylococcus. So this diagram over here is how wounds typically heal. So the cut blood vessels bleed into the wound and a blood clot forms in the wound, and phagocytes destroy these microbes. The wound then fills with granulation tissue and blood vessels start to regrow. Scar tissue then forms and collagen contracts and epithelium then regenerates, causing a scab over the wound. Treatment of Staphylococcus wound. First, you want to soak the infection with a warm washcloth. Then apply a heating pad to the infected area a couple times a day, about 3 or 4 times, for about 20 minutes. If you don't have a heating pad, you can use a warm water bottle or something like that. Then you want to apply antibiotic ointment, but ask your doctor if this is the right treatment for the wound you have. Drainage may also be needed from the wound if it is severe.
Okay, hello everyone, my name is Yvette, and I will be talking about the bacterial wound infection of anaerobic bacterial diseases, so without oxygen present, Fusobacterium. So the bacteria responsible for this one is the F. nectarophorium. Is a bacilli that is found in normal flora in the gastrointestinal tract, oral cavity, and the genital tract. So this infection is really rare, but is severe if it's not treated properly. And this is not infectious naturally in your body. It has to get caused by another bacteria to be infected to cause any harm. So if you do get sick, the signs and symptoms include high-grade fever, sore throat, exudative pharyngitis is when the pharynx become inflamed, and then parotonsillar abscess is an abscess in the throat next to the tonsils. You can also get headaches, and if it goes untreated, there will be severe neck pain and swelling. So if you look at pictures, there can be swelling. Can be caused by the bacterium in the throat that will be infectious by the mucous membranes near the tonsils. So it's the mucous membranes that actually get infected. And most commonly, even though it is found throughout the body, it's usually near the tonsils in the back. So then, if it would go next. Okay. And then, so prevention and treatment. The bacteria is most commonly known as Lemierre's syndrome. It is difficult to prevent this disease because the bacteria infects the mucosa of the throat, but there's no distinct reason how or why. There is speculation that it probably is from trauma or surgery of the body of some sort for it to get infected since it's not exposed to oxygen. Antibiotics usually given is clindamycin and metronidazole and amoxicillin, so antibacterial medication. And so this is caused by an infection in the neck that will form a blood clot. If it's not taken care of properly, it is made up of some pus in the interjugular vein, which causes serious clotting the rest of the body. So a blood clot is called septic thromboitis. So if you've seen the picture over here, there is the bacterial infection that might cause in the throat, and then there's the interjugular vein carries blood away from the brain, neck, and face, so the rest of the body clotting includes lung or brain, so it can be very dangerous. So this part, the local venous so that's the blood clot right there, in the red, and then so that's why it can be dangerous if you don't get it taken care of, and that's what happens with Lemierre's syndrome. And so takeaways from this disease is that it can cause this syndrome, the Lemierre's syndrome. It is treatable for less than 5% of people that get diagnosed, or is treatable, and less than 5% of people diagnosed die. It's usually people that aren't very aware of this syndrome. It is very much treatable with antibiotics as long as people take them. And the Fusobacterium is a bacterium that naturally lives throughout the gastrointestinal tract, and it's the interstitial mucosa that is actually infected. And if it's not treated with antibiotics, a lot of side effects and could die. But as for prevention of this is, along with a lot of bacterial infections, it would be taking measures such as hand hygiene and not sharing drinks and food with other people.
Hi, my name is Tracy Colliot, and today I'll be talking about the lower digestive system for bacterial diseases and viruses. First, I'll be talking about bacterial diseases of the lower digestive system. I chose to do the topic and the bacteria Salmonella. So Salmonella are a group of bacteria that causes gastrointestinal illness and fever, and this is called salmonellosis. Salmonella is commonly spread by improper hygiene and improper handling of food. So by food handlers in fast food restaurants and restaurants in general who don't wash their hands after touching raw meat or eggs are likely to spread it to other surfaces, so that surfaces become contaminated. And it can come from eating raw, uncooked meats and eggs and other dairy products. And salmonella can also be transmitted directly from animals like reptiles and poultry. Symptoms of salmonella include diarrhea, fever, abdominal cramps, lethargy, rashes, and blood in the urine or stools if it's bad. This picture to the right here is just a picture of the salmonella bacteria in a microscopic form. The next topic is prevention and treatment of salmonella. So the main way to avoid the spread of salmonella is proper handling of food. This will help kill salmonella and prevent the spread. So that foods that include salmonella are meat products, vegetables, eggs, and dairy products. Irradiation of these products will help lower the risk of obtaining salmonella, but also proper hand washing techniques and disinfecting of surfaces, especially in restaurants and fast food. Proper disinfecting is important. Treatment of salmonella includes antibiotics since it is a bacteria. So antibiotics like fluoroquinolone for mild cases and amoxicillin, or trimethoprim sulfamethoxazole, and over-the-counter meds to treat other symptoms. The next topic is viral diseases of the lower digestive system. I chose to talk about viral gastroenteritis, which is commonly referred to as the stomach flu. So this is an intestinal infection, as seen in this picture here on the right. It's an inflammation in the stomach caused by this virus. Symptoms include watery diarrhea, abdominal cramps and pain, nausea, vomiting, muscle aches and headache, and a low-grade fever. Symptoms usually start coming out with 1 to 3 days of being infected. And if symptoms worsen, you might see vomiting blood or a higher fever, and that's when you'd want to consult a doctor. The prevention and treatment of gastroenteritis. So there are vaccines out there that will help create immunity to this, but again, proper hand washing and disinfecting of surfaces will prevent the spread. Avoiding raw food, contaminated water, and unwashed fruits and vegetables will stop the initial infection of this. And to treat this stomach flu, probiotics and over-the-counter meds will do the job. So probiotics will help lessen the duration of diarrhea. Rehydration with sports drinks and juice and water will lessen the symptoms and help prevent the vomiting and diarrhea as much. And then you can get innate immunity from this for the norovirus and rotavirus, which are just the 2 types of viruses you can get of the stomach flu. And this can happen genetically or by memory cells. But that's all I have to talk about. Thank you.
Hi, I'm Kelsey, and I did a protozoan disease of the lower digestive tract. And a protozoan is a single-celled eukaryotic organism. They can be amoebas, parameciums, or trypanosoma. And the disease that I did is Giardia, which is a waterborne illness. It's the most common waterborne illness in the United States. It's also known as backpacker's diarrhea or traveler's diarrhea. The actual protozoan is Giardia lamblia, and it's often found in water of contaminated mountain streams, and it can be in municipal sources as well, or city water. There's an incubation period of 6 to 20 days, and it can range from mild symptoms of indigestion and gas all the way to severe, which would be vomiting and diarrhea. Prevention and treatment. Prevention includes ensuring that your water is clean and filtered. For hikers, this includes boiling water if you get it from a natural source, doing some sort of filtration, and then even adding a drop of household bleach to kill anything that's in their water. For municipal or city water, no amount of chlorine or chemicals can kill the protozoan in its cyst form, so it has to be filtered out. Treatments for this disease are antiparasitics, but it is mostly self-limiting, and severe cases are treated with antibiotics.